Imagine standing by a hospital bedside, watching a young patient struggle for every breath, while knowing that the weapon we rely on to protect them was invented over 100 years ago. As medical students and residents, you deal daily with the harsh reality of tuberculosis, an ancient pathogen that remains the leading cause of death worldwide from a single infectious agent. Every single year, nearly 11 million people contract tuberculosis, and more than 1 million souls lose their lives to it, devastating entire households across high-burden countries like India, Indonesia, China, Pakistan, the Philippines, and Nigeria. The Bacille Calmette-Guerin vaccine, which we routinely give to newborns, works well against severe childhood manifestations, but offers terribly variable protection against adult pulmonary tuberculosis, the very form driving global transmission. This massive clinical gap is precisely where your future medical career meets the front lines of revolutionary global health, business, and translational science. In a historic development, the Serum Institute of India has officially partnered with the Gates Medical Research Institute to manufacture a groundbreaking experimental tuberculosis vaccine known as M72-AS01E. If approved by global authorities, this asset will become the first brand new tuberculosis vaccine introduced to humanity in more than a century. The Bill and Melinda Gates Foundation, alongside Wellcome, have funded the late-stage clinical development, which reached full enrollment of 20,000 participants across 54 distinct sites in African and Asian nations. To prepare for this monumental shift, the Serum Institute of India is proactively investing more than $100 million of its own resources to build out massive manufacturing capacity long before final Phase 3 data is published. This deliberate commercial strategy ensures that the moment regulatory green lights are given, millions of doses can be shipped immediately to high-burden regions. The innovative vaccine works by combining the specific M72 bacterial protein antigen provided by the Gates Medical Research Institute with the advanced AS01E immune-boosting adjuvant supplied by GlaxoSmithKline. In mid-stage testing, this specific formulation demonstrated roughly 50% protection against active disease progression in infected adults over a 3-year window. For future clinicians and public health leaders, tracking this case study highlights how the intersection of biopharma, global philanthropy, and massive manufacturing creates viable paths to wipe out endemic diseases. The World Health Organization estimates that a vaccine possessing this exact therapeutic profile could successfully prevent 76 million new infections, save 8,500,000 lives, and preserve more than $41 billion for vulnerable households over the next 25 years. As you advance through your residencies and medical training, understanding these large-scale pharmaceutical alliances will help you anticipate shifts in clinical guidelines and therapeutic access on a global scale. Welcome to the Digital Healthcare Center of Excellence, where we dissect the macro trends defining your medical future. We invite our community of medical students and residents to ask any questions or share your thoughts regarding adult tuberculosis immunization strategies in the comment section below. Please like and share this case study with your peers if you found this breakdown useful for your career development. We highly value clinical discourse, so please provide your candid feedback if you do not find this useful, or if you disagree with any specific medical or economic aspects discussed. Make sure to subscribe to the channel for future medical updates, and do not hesitate to contact us directly to set up a personalized career consultation.